The question that everybody wants to know, what do you actually do for lower back pain? And that is actually a pretty loaded question, but let's dive into it. But first we have to separate acute lower back pain and chronic lower back pain. Acute lower back pain can be pretty intense symptomatically, but it can also be shorter in duration. Maybe you had some form of traumatic injury, or maybe you lifted something in a weird way or something like that. But the good news is the symptoms only last for less than 6 weeks, and they tend to get better on their own, with or without help from a clinician. The general idea is you want to avoid complete bed rest. And you do want to move as much as you can to kind of desensitize the body and let things calm down. As far as like chronic lower back pain or pain that lasts a bit longer, this is what I want to focus on today. These can be more tricky clinically. You've probably heard patients say something like, oh, I've had this pain for like the past 10 years or something like that. So I stumbled upon this systematic review that dives into this exact topic. They categorized chronic lower back pain as something that lasts greater than 13 weeks. And the interesting thing is, up to 90% of the time, the clinician cannot find a specific diagnosis, especially in patients with chronic lower back pain. And what that means is we don't exactly know what is the source of your pain, what is creating this experience. It could be a lot of things. We know that if you get imaging, chances are you'll find some sort of abnormal changes on your image, even as early as in your 20s or 30s. Is that the reason for your pain? Maybe. But here are some other things that you can dive into on top of just the tissue diagnosis. Are you fearful of movement? Are you fearful of bending your back? Are you getting some form of regular exercise? Do you get quality sleep? How's your stress level? And we now know that all these things can feed into the experience of pain, so it's very important to check, especially in patients with chronic lower back pain. So back to the question, what do you actually do for chronic lower back pain? Give me the exercise that I can do for chronic lower back pain. So this systematic review looked at a ton of studies and tried to compare the effectiveness of each exercise intervention. More specifically, they looked at 89 studies with a total of 5,578 participants. The truth is, there's a ton of variability within the field of PT too. Some PTs love doing strength work. Some PTs swear by the McKenzie method for treating lower back pain. Some PTs are all about yoga. So this article also helps to bring some clarity to what do we do. So let's see what they found. They used this SUCRA score, surface under cumulative ranking, to take a look at which intervention can be more effective. And they were looking at different outcome measures. So for dealing with pain, they found that Pilates, some form of aerobic exercise, and stabilization or motor control exercises tend to be the most effective. So the hands-on group is just the therapist is doing some type of manual therapy. The hands-off group is just providing some general advice. And the true control group is completely doing nothing. So if we're looking at physical function, so how patients viewed their physical function after doing these exercises, is that they found to be most effective for stabilization and motor control training, resistance training, and then some form of water-based activity, Pilates, and yoga. Again, they compared it with therapist hands-on and hands-off controls, and they found that all those forms of exercises were better than the controls. And for improving mental health, they found that resistance training and some form of aerobic training were the best. What about for improving muscle strength? They found that some form of stabilization and motor control training and resistance training were the best. So that was a lot of data, and patients usually come to see PTs because they are in pain. Based on this systematic review, the best exercise for pain is Pilates. So do we force everybody with chronic lower back pain to do Pilates? Probably not. I think as much as we want a clear, definitive answer, the truth is they all seem to work. Whether it's water-based, yoga, Pilates, resistance training, they all seem to help. The goal of PT is to get people moving better and feeling better. I think it's up to us to really help patients to stick to one particular activity that they enjoy doing. And the results of this review is pretty consistent with the general consensus when it comes to what do we do with people with chronic lower back pain. So here's another systematic review that was done a couple years ago. It says, non-specific chronic lower back pain is multifactorial in nature, and no single exercise program is optimal for all non-specific chronic lower back pain patients. Additionally, many PTs in the past used to think that just do core stabilization and you'll solve your back pain. But now we realize it's more than just that. Here's yet another review that found that there's no difference in long-term outcomes when comparing aerobic exercises versus stabilization exercise. And another one saying that stabilization exercises aren't that special. The moral of the story is there's no one best exercise that's gonna help with lower back pain. And what works for you may not work for other people. The best exercise may be the one that you actually like doing. Let me know if you have any questions or comments. Like and subscribe if you enjoyed this type of content, and there's more to come.